In his daily briefing, Mayor de Blasio again said the city is ready for the next major vaccination campaign.
Within 24 hours of the CDC guidance, vaccination for the youngest New Yorkers, 5 to 11, will be available at the city-run sites within 24 hours of the announcement. And then within 48 hours, the vaccinations will be available at pediatricians' offices, pharmacies, and other types of vaccination sites.
The preparations come as the CDC is expected next week to issue guidance on vaccinating youngsters 5 to 11 years old with a smaller dose of the Pfizer vaccine after an FDA panel declared the benefits of vaccination for that age group outweigh the potential risks in guarding them against COVID-19. The city's Dr. David Chokshi joined the mayor to remind the public how closely scrutinized the vaccines have been, and that half the world has been immunized, including over 15 million U.S. kids 12 to 17 who have received at least one dose of the Pfizer vaccine, more than 400,000 in New York City.
While COVID-19 is thankfully sickening fewer children than adults, it remains a risk. Across the country, more than 6 million children have been infected, some with long-term effects. More than 23,500 were hospitalized from it, and sadly, it is the nation's 8th leading cause of death for children 5 to 11, according to the FDA committee.
Chokshi says the Department of Health is working with about 1,500 area community pediatricians and family doctors, as well as pharmacies across the city to engage their patients and families and plan toward the logistics in getting the vaccine into arms. At her COVID update on Wednesday, Governor Kathy Hochul says the state is ready as well.
We've been making preparations for weeks now. I had spoke to the New York chapter of the American Academy of Pediatrics to get all their pediatricians on board. We've been in regular communication with all the providers. So it's going to be various places that parents can go to have their children vaccinated as soon as it's available.
Dr. Emily Lutterloh, New York State Director of Epidemiology, will head the state's vaccine effort.
If you're a parent, ask your pediatrician if they'll be giving the COVID-19 vaccine. Talk to them about any concerns you have. Be sure to get the facts from a trusted, reliable source like your doctor, and then make your appointments.
Now, again, the FDA's advisory panel did accept Pfizer's data indicating the vaccine was safe and 90.7% effective in preventing COVID-19 in that age group. Again, expect a tense week as city and state health officials across the country watch and wait for moves by both the FDA and the CDC.